Hi everyone, this is Jacqueline. I'm going to demonstrate how to prime your IV tubing. You would start off by washing your hands, and today I'm going to have all my supplies hang on this rack because I don't have a table that's at my waist or above my waist height. So you would start by following the 6 rites of medication administration, and you want to follow the doctor's orders. So this medication or solution will come in a sterile package. You want to make sure that that is intact. You want to make sure that you have the correct solution, check the expiry date, make sure you have the correct size, make sure that it's not discolored and that there's no floaty bits, and that it is not leaking, so there's no precipitation. You can give it a squeeze and make sure that it isn't leaking and it is not, and it follows the doctor's orders. Now with the tubing, you want to make sure that it also follows the doctor's orders, that it's the correct tubing, and that it is the correct chamber size, and it comes in a sterile package that is all intact, and it should come with these 2 end pieces, which it does. And so I'm going to start off by taking off this cap, and I want to make sure that my clamp is locked, which it is. Remove this cap and insert it all the way so it does not leak. Now I'm going to fill up this chamber to 1/3 to a half, and now it is. Now I'm going to loosen the clamp, and I'm going to fill up the solution just before this Y port. And now I'm just going to drum it to remove any air bubbles. Now I'm going to open up the clamp, and I'm going to let the solution flow all the way just before this end. And I want to keep this end above my waist height to make sure that it remains clean. And it is right here, and I've locked it, and now I'm just going to drum all bubbles, and there doesn't seem to be, oh, there's 1 or 2 bubbles. And now I'm going to grab a sterile bag, and I'm going to remove this cap, and I am going to prime the solution all the way. So I'm just going to open up this clamp and let it pour into this sterile bag. Alright, there you go. Now it is ready to administer to a catheter, and before I would do that, I would check with the patient skin to see if it is red, if it is swelling, if it is irritated at all. And of course, before I would do that, I'd tell the client who I was, and that I was a student nurse, and telling them what I was going to do. And I would close the curtains for privacy, and then my hands would be clean as I would start this process. And after I inserted, I would open up the clamp again, and I would make sure that is the correct drip rate following the doctor's orders. And I would label the solution and tubing. I would put my initials for my name, and I would date it, and I would put what medication is and the time. Alright, thanks everyone. Oh, and if I were to add another medication to one of these ports, you would have to clean it with an alcohol wipe 3 times in a circular motion. Right, thanks everyone.